Lagos. It's still a conversation here on Lagos Television. And on the segment, you know how we do it. We talk about everything that has to do with Lagos and anything Lagos. Every year, nearly 400,000 children worldwide are diagnosed with cancer, while survival rates in high-income countries exceed 80% in many low and middle-income countries, including Nigeria. Survival drops to between 20 and 30%. That's according to the WHO. In Nigeria alone, an estimated 10,000 children are diagnosed annually, yet many cases go undetected or are diagnosed too late due to myths, financial constraints, and limited access to specialized care. Today, we'll be separating fear from fact, and seated here with me is Korede Akindelele, Global Paediatric Medicine Program Expert and COO of Dorcas Cancer Foundation. Thanks for joining me.
Thank you.
Thanks for joining us on the show this morning.
Thank you.
Okay, let's understand the basics of childhood cancer. What exactly are we dealing with here?
So, like it is, cancer just is an abnormal disease that occurs in the body and divide the cell. So that's what cancer. The same word cancer that we say in adults is the same word cancer that we see in children. And so there is no different, but the thing is just that the cancer in children is different from the one in adults.
Okay.
And mostly, you know, when you talk about adults, you're talking about breast cancer, colon, prostate, cervicals. But for children, we see brain tumors, we see leukemia, that's the blood cancer. We see Wilms tumor, that's the cancer of the kidney. We see retinoblastoma, that's the cancer of the eye. And so, but the cancer, it's a disease that is abnormal, and then it divides the cell. So it's just the same thing that occurs, but the difference is the one in children is quite different from the one in the adults.
Okay. When we're talking about childhood cancer, I'm a bit confused, because cancer in adults is about, you know, sometimes inherited, is sometimes about lifestyle risks and all. But for children who are yet to be exposed to lifestyle risks and of course acquiring, you know, this cancer or inheriting it, how do they get this cancer?
Okay, so just like you said,
and does it occur in what age when we're talking about children?
So it's from 0.
So even from birth?
From birth, yes. A child could have cancer from birth. So it's a cell that decides not to go, and it goes abnormally. And just like you said, there is nothing, scientifically it has not been proved that this is the cause of cancer in children. But when we try to look at the genetics, we can say like 20%, but you can't pinpoint and say, oh, this is what this child done wrong, or this is what the parent does wrong,
did wrong
that makes this child has cancer. But it's just like an abnormal disease that occurs in the child. But the good thing is, if it is early detected and properly treated, children do survive cancer. That is what we have seen, and that is the good thing that we try to let people know, that look, it's a message of hope and survival. All it needed to be done is to pick it early, treat it well, and the child will survive. So there is nothing anybody does that make a child has cancer. It's just something that will occur, and that's why, and the way it presents itself, you know, for like adult, like you said, for breast cancer in adults, you can say, okay, maybe you have a lump, or maybe you've seen some discharge, or for lung cancer, you can say, okay, maybe this person has risk factors, maybe smoking or this. But for children, there's nothing like that. It presents itself like an illness. And that's why it's so important not to take every illness that occurs in a child for granted.
So what should parents now look out for, aside from those who were born with it, that, you know, during investigations, you know, they would quite quickly see it. So for children who are at home with their parents, what should parents now look out for?
So as a parent, the most important thing is to pay attention to your child, so you know your child very well.
Okay.
You know if this child is active, you know if so let me start an example of maybe the cancer of the eye. That's retinoblastoma, that's the cancer of the eye. The eyes start looking like a cat eye. There is a number that your eye should look.
Does it change does it change color?
Yeah, it changes now. it changes into white. You see white, and then not that, but it has this cat look.
Cat, yeah.
Yes, not cataract, cat.
As in cat eye.
Yeah. So when you take picture in the dark, normally your eye should blink red into the picture. You know that happens.
Okay. Yeah.
But when you switch off the light and the eye started looking funny, or the child is looking in a direction, it's not paying attention into a direction, then something is wrong somewhere. It doesn't say it is a cancer.
Okay.
But it gives you an attention to say, you know what, let's pay attention to this child. So I have a child like that. His name is Perfect. So he was perfect. So I call him Perfect. That is perfect.
Perfect.
So he was at home with his family. He was writing, I think, doing his assignment, and there was power outage. And then in the dark, and someone that noticed his eye is glowing like the eye of a cat, and they feel like, no, something is wrong. So they took the child to the hospital, and then quickly they said, no, this is not normal. Then there's a problem, and then everything was done. Surgery was done, chemotherapy. And the child is fine today. Perfect is perfect. He's back to school. He's in, I think he's 12 years old now, and he was 5 years old when that was done. And the guy is doing fine. So as a parent, it's important to pay attention. And one thing that we say very well is, you know your child very well. If this child is not responding the way, you take the child to the hospital, and that's why we try to even educate people at the, you know, when we are sick, we go to primary health care. Some people, not everybody that goes to maybe
the big hospitals,
immediately. You go to the primary health care, and everybody that we've seen, that I've worked with, every parent that we've seen, will say, I take my child to the hospital. They take the child, but no parent will put their child at home. You can't have a sick child and say, okay, stay at home. No, you will still go to where you think this child could get care. And then we've seen children going to hospitals 6 months before somebody said, no, something is wrong. And so when you've taken a child to the hospital, then you've seen that in the space of 3 to 4 months, our going and coming has been so frequent, more than 6, 7 times, and something is wrong somewhere. Now, it doesn't say that child has cancer. So again, maybe the child has done transfusion maybe in 2 months, 2 times, then something is wrong. So we request that, please, can I see a pediatrician?
Okay.
That's the first line.
Okay.
So a pediatrician knows things are wrong when they see it.
When they see.
And so when they see that this is wrong, something's wrong, they call for some tests, and they refer you appropriately to a pediatric oncologist who is going to deal with the illness. So it's your own. So to pay attention on your child's health, it's not getting better. You've gone into the hospital, you notice some. If you're trying to bathe for your child or you're pressing the body, you notice some lumps, and the child is trying to tell you not to feel your Wilms tumor. See that the tummy has different kind of density, something is shifting somewhere. Don't just look at it. Or the child is pale unnecessarily. All those things are signs that you need to pay attention to. So it's better to be safe than sorry. So when you get to the hospital and they run the test and say, no, it's just child illness, that's fine, you're good. So that's.
So what does treatment of these cancers, what are they usually like? I know some surgeries are done for some, chemo are done for some, radiotherapy are done for some. So let's talk about the process of treatment for the different cancers.
So just like you mentioned, the standardized treatment is chemotherapy. And if surgery is needed, they go into surgery, and then radiotherapy. Okay. That is the standard care.
Oh, that is the
that is the
process.
Protocol
to
treat. Okay. Yes, there can be other targeted care, but the standard process is the child starts, when the test is done and they know this, they can start with chemotherapy. For example, if it is Wilms tumor or maybe a brain tumor that they need to pull out something, they can decide to do a surgery and take away the tumor, and then start chemotherapy. And then after a cycle, maybe 6 cycles of chemotherapy, they do a test again and say, okay, now it's time for us to go and do radiotherapy. And then they take the child to radiotherapy. So the standard care that we know, that we have seen work, we have tested and trusted, and it is accepted globally, is chemotherapy, surgery, and radiotherapy.
I'm going to come to chemo when we're talking about myths and misconceptions, but I want to talk about treatment for these cancers. How long does it take? How long does it last?
It's a journey, and there's a treatment plan. It's not just something that, okay, it happens, okay, let's start treatment. There is multidisciplinary team that sits on every case and then decide to say, okay, this is a plan. This is going to be 6 cycle, and this is how it's going to be.
Okay.
So what we've seen 3 years. We've seen more than 3 years.
Okay.
But the journey are always long. Sometimes it can be 1 year plus, but the minimum that we've seen is 3 years. And it's a journey. It's a tough journey.
Okay.
But all we just keep doing is to encourage people that go through this to just adhere to their doctor. We know it's not easy. You know, you are, especially if it's children. It's so touching. But we know, we've seen it work in Nigeria. And that's why we just advise people, no matter how long it's been, you need to be strong for the child. You need to be strong. It's emotionally drained, but just go through it and then seek support to go through it together with you.
Okay. I want us to understand something about early detection now. Do all cases, detected early, and when treated is a success? Yeah. All cases.
When
detected early
and properly treated,
and
it's
properly.
a success. It's a success.
Okay.
Yes, I have cases, and I can say it's a success. Okay. I have more than not 10, not 15, not 20.
Okay, so why do some parents now, run away from treatment? From your experience with dealing with different cases, why do parents, keep their children away or run away or shy away from their children's disease?
So it's a multifaceted problem.
Okay.
And I
think that will take us into the misconceptions and the myths. Yeah.
It's a different problem.
Okay.
One of the problems is funding. And
So how expensive?
It's expensive.
Okay.
Healthcare is expensive everywhere in the world. That's just the reality.
Okay.
We all know that it's expensive. And some people...
Can you put a figure to it?
Okay. It depends on the cancer. The type of the cancer.
It now depends on the type of cancer.
The type of the cancer. Because, a radiotherapy treatment, radiotherapy is costing, just for the machine alone, maybe 1.6 million. And let's just say that's radiotherapy. Then let's say you're going to go through cycles of chemo. And for us, when we are going to start treatment, we say, okay, let's keep this 3 to 5 million somewhere and let's start this journey. So
that's draining.
It's draining. There is it's financial draining. So there is no amount of money that you even have as a person.
As a person,
you feel that you are going through something. That's just reality. And so funding is one of the critical things. And people, you give them these, and you tell them this is what it's going to cost. This is what it's going to cost. This family just look at it. Where would I get this money? Even if I sell my head, I can't get this money. Please, let's just go. I have other children to take care. So that's what we've seen in treatment abandonment and also misconception too. We are a very great religious society. There's different kind of things that can. So those things are also there. But one of the critical things that we have seen that brings treatment abandonment is funding. Emotional drain too are there. And that is why patient navigation is so important. Patient navigation is so important. What is patient? What I mean by patient navigation is someone, we work with it, when the family have seen the oncologist, they give them the news. So there is someone called a patient navigator.
Like a support.
Like a support.
Okay.
Is within the hospital system.
Oh, okay.
So this person receives
the child.
This family.
Okay, the family.
With the child and say, this is what the doctor have said.
Okay.
And break it down in a simple way they can understand.
Okay.
And then help them to navigate the process.
Okay.
So now you need to start the test. So this patient navigator take away the burden out of the parent and say, you just face your child. Just stay beside your child in the ward. You need to pay for tests. I'm going to help you. I'm going to go there and pay.
Going to do the running around.
Yeah, running around. So the patient navigation do the running around and ensure that this person does. So when even the families are tired, they call and say, hello, how are you feeling today? Tomorrow, next tomorrow is your treatment, try and come in. Oh, we don't have transportation to come. Okay, what can we do? It speaks to someone that is a financial navigator. So there's also a financial navigator. So it speaks to these people that are financial navigators and say, you know what, there's a patient that needs to come, and this is the system we've worked with and is working. So there's a financial navigator so you say, okay, this patient needs to come next tomorrow and they don't have transportation. So as simple as transportation fee, even if they've gotten drugs for free, all these things, as simple as transportation fee, as simple as admission fee. We've seen parents stay at home and say, okay, if I come, there is no food for us to eat when we are in the war. So I'm trying to get the money. So those are the things that aim at. But we try as much as possible to raise awareness, to raise advocacy, and to say, you know what, you are not alone. So we have a patient navigator that works with you all through this journey. You just do what? Focus on your child and leave the rest.
Just you talked about financial navigator.
Yes.
You talked about the support system. Does this support system, who is also a patient navigator, also support emotionally? Because at this point in time, you will be drained, you will be overwhelmed. You know, there's somebody who would just keep you going. Yeah,
that's true. So, and I'm going to cite an example quickly. I was in the hospital and I cited a patient. I cited the mother, and I told my patient navigator, I said, this woman is tired.
It should be.
I know, because they travel all the way from Oyo State to Lagos, and they have to sleep on the, I mean, after they were doing radiotherapy, yes, and after 30 minutes of radiotherapy, they don't have a place to stay. They stay with the corridor. And she was reacting to this child. This child is an adolescent. So she was, you know, she was like, I felt inside her like, my life is stuck here, because and I'm trying to call you. And she was not saying it, but it's reading all over. I could see it. And I said, you know what, this woman is tired. Let's quickly just talk to her. She needs someone to talk to.
She needs support.
And then it's an emotional support. Exactly. And that's what we talked about a lot of time, that we ask people to visit the ward.
Because it goes a long way.
It goes a long way. People say, I don't, it's not about you giving someone money or you providing. We've seen people come, and so I have a survivor. She's survivor of nasopharyngeal. That's a cancer of the head and neck. And then she's a survivor now, very amazing, beautiful girl. And then so she did a ward round, and there was another patient who was going through it. Yeah. And she was with her, and the girl was so happy. The girl felt that, oh, somebody came to see me today, and that's a lot. You just coming into it, and that's why I said, you don't need money. Just come into the ward, visit them in the ward, and say, we just came to, just hold their hand, pray with them. That light, that glow, you will see that, oh, some people remember us here, that we are not alone, that we are not going through this alone. So emotional support is part of it. Financial is part of it. But you know, without, you can give emotional support. If you have to pay for chemotherapy and they don't have the money, you have to also bridge that gap.
Okay, I said we're going into the myths and misconceptions about cancer. You mentioned chemotherapy as one of the treatments a cancer patient will go through. There's this fear about chemotherapy. It is believed that chemo kills even more than cancer itself. I'd like you to talk about that, either to correct it or to debunk
definitely
it.
It's a toxic treatment. It's something. It's something heavy that you want to use and kill something.
Some call it poison.
Well, I don't call it that.
Some call it poison.
I don't call it that. But see, this is the protocol.
Okay.
This is the system. And we have amazing oncologists in Nigeria. I'm privileged to have been working with these wonderful people for the last, going to 9 years now. And I've seen the great work they've done. They are like 77.
With children?
With children.
With children.
Yes, pediatric oncologists across Nigeria, they're like 77. And we've seen amazing
77
work.
Of them?
Yes.
Wow, we have so much.
We've seen amazing work that they've done. They try as much as possible to bridge the gap, even if it's going to be harmful in the body, but they have measures to make it go seamless. And there are reactions, and that's why when they're going through this, when they've gone through chemotherapy, they don't release them and say, "Oh, They help them go for reaction clinic and see, okay, how is this reacting in your body? And if it is reacting negatively and it's not even, it's bringing more discomfort that is expected, they can sit down and say, okay, let's change this protocol like this. Okay, this is the protocol we are using. Why don't we see these and use?
See how it goes.
Yes, it's just rare cases if this needs an aggressive push. And I guess that's why they insist, but they are wonderful people that knows how to do this job. So it's toxic, that's the reality. But we have wonderful people that take this treatment into the body and it does the work it does. Even when you are going through the effect of it, it's been managed. And not just that you just give in and then your body system shut down and everything, but truly it is, but there is no other way now. The way to eat is this 3 way. So please,
I think you know I want to ask this question, another question. You know?
Please don't. I know
don't
people
cut
say
corners.
Don't
cut corners. Yeah.
Please let your doctor know what you're doing.
They know what they're doing.
Yes. So please just work with them.
But I'm still going to ask you the question I want to ask you. You know, these days, maybe because of poverty, of course, you mentioned funds earlier. Sometimes ignorance, sometimes self-denial. People now go to use herbs. They take their children through that route to take herbs. Do herbs really cure cancer?
Based on all the work that I have done, I mean, scientifically, my oncologists, my radiation oncologists, my surgeons, everybody I've worked with, have not told me that herbs cure cancer. So maybe if after now, one of them can watch and say, no, we have another one. But
maybe after now. After
this moment that I know and the privilege of the explosion of knowledge I've been exposed to, there is nothing of such. And that's why we try as much as possible and even base awareness. I mean, we're not trying to just cascade anybody's work or anybody what they are doing, but there has not been any scientific proof towards it that says this cure cancer. And that's why we try as much as possible, like I said, to raise awareness, to even raise awareness with this traditional healers and say, you know, you need to be aware of this kind of disease. And when you see this, just encourage people. And that's why advocacy, awareness is important. And when we do awareness in stages. We don't just do it and say, okay, this is one way we do awareness. Awareness with the community. Awareness, and when you talk about the community, we're talking about the religious leaders, the traditional, because they need to be aware.
Community
leaders. So what? And so they are like a gatekeeper, and they live in a community and see a woman, child, and say, oh yeah, take this child to the hospital. That's their responsibility. Don't sit at home and cause problem for us in this community. So this child is not feeling fine. So we empower them and make them ambassador, gatekeepers of the health of children in their community. So they are taking risk. So either you're any religion you're practicing, you are an ambassador to a child health.
Okay, from your years of experience and working with cancer children and their parents, I've mentioned some myths. Are there other misconceptions, you know, that parents or Nigerians still hold on to that you want them to do away with this minute?
So I think some of them is what we've talked about: self-denial, religious misconception, funding, which is there, and lack of awareness. I think awareness is still, and that is expensive. We can't deal with this. Oh, it's a death statement. No, it's not a death sentence. It's shocking. So the most important thing I want you to know, what I've come here for this morning, is simply the message of survival and hope.
Survival and hope.
Hope to someone going through this challenge right now. And I want you to know that you are not alone. Reach out. What you need might not be money. It might not be somebody to just speak to you and encourage you through the journey. We've seen children survive cancer and they are doing fine. And just work with your doctor. Childhood cancer can be survived. Follow the processes. It can be draining, it can be emotional, but just stick to it, hold on to it, you will come out by God's grace. Survivor. Children do survive cancer. It's not a death sentence because they are reproducing themselves. And so that it's a death sentence, that nobody survive, those are misconceptions. And following the protocol, following the systems of your doctor, of your pediatric oncologist. And I'm going to say this in few words, that if your child is sick and it's been repeatedly occurring, you're seeing this we are called every time. Request from that, either a private hospital or a primary health care, that please can I go to a place where I can see a pediatrician? Maybe we call it general hospital, the big ones in across. Be patient, because people say, no, the stress is too there, I can't. Please, it's for your child. Ask to see a pediatrician. That pediatrician knows what you're doing. And so they can refer you to a place. Because we've seen people that they give diagnosis and they go back home. And then when don't do anything. And when it has now become,
when it escalates, you see them now coming for miracles. And even, I mean, some of our health officials too, in some good places, don't hold on to it. It's not something that can be treated. Allow this patient to see the appropriate person. And you too, as a parent, if a doctor is not, carry your child to where the child can take. So self-denial, religious concept, all those things are there. But see, just ignore those things. They cannot help you. I've seen, in quiet journey, I've seen the good and the bad and the ugly.
And I can tell you that sticking to what your doctor says
will always work.
Will always work. I mentioned perfect, that is perfect.
Perfect, yeah.
I have Inioluwa, that is amazing. I have Samuel, that is doing great. I can mention names of, and they are back to school. And even if maybe in the course of it, they lose their eye, maybe for a brain tumor or something, and there are schools they could go to and they could back to their life. I have Tomiwa back to school, doing amazing. I saw, what's his name? I saw one last week in Adeseyeye. So so they have life. They are children. They will take up their life back. So don't write them off. Ask for help if you need. We have experts that has done this and they will guide you.
Ask for help, and there are people there to guide you. Childhood cancer is not a death sentence, and it is not a curse, according to some, misconceptions. Thank you very much, Korede Akindelele, Global Pediatric Medicine Program Expert, COO, Dorcas Cancer Foundation. With early detection, proper medical care, and the right support system, many children can survive and still thrive. We'll go on a short break. When we come back, the conversation continues.